Welcome to our latest episode of the Lebanese Physicians Podcast. And today we will be talking about medical informatics and the role of artificial intelligence in healthcare. And our guests, this episode is co-hosted with Dr. MohammadAli Jardali. Our guests today are Cynthia Abi Khalil, who is the nursing director at Lebanese Hospital-Geitaoui, and who's actually going to be Dr. Cynthia Abi Khalil very soon because she is doing currently her PhD in medical informatics at the Sorbonne in France. She has been director of nursing at Geitaoui for multiple years, 6 years, and she has been through everything that's happened at the hospital, including the August 4th explosion and the rebuilding of the hospital. And also, another guest with us today is Dr. Antoine Saab, who liked the podcast so much that he decided to come back and assist us with the podcast. Thanks to everyone for attending.
Thank you. We're very happy to be your guest today.
Thank you.
We're recording this episode in person. This is the second episode we record in person, and the first episode we record in Beirut. So it's a special episode, and it's going to be a good one.
Exactly. We're recording this episode at Paul and Jemaisli, and hopefully we'll record some more episodes over here too in the future. So Cynthia, we heard that recently you had a big conference at Lebanese Hospital-Geitaoui discussing medical informatics and the digital era with multiple hospitals in Lebanon. Can you tell us more about this conference and the reason behind it and which hospitals were involved?
Yes, I'm very happy to see you in person, guys. So because I'm lucky to see you not over the screen. So talking about the event, in fact, the Lebanese Hospital-Geitaoui UMC hosted an event on May 30 this year, talking about care in this digital era. And this event was initially for nurses because it was for like May, we celebrate nurses all over the world. So it was about asking nurses and the faculties all over Lebanon and the hospitals trying to think together about what will be, what the care will look like in the future and what will be the role of the nurses and what changes would be undergoing in our role. So because we have EMRs, we will be having new tools, assisted artificial intelligence, robots, maybe wearables, etc. So we hosted this event and we had a conference, interesting conference about simulation, wearables, predictive analytics, AI, ChatGPT. And we had a panel with AUB, Hotel Dieu, Room, and many faculties thinking together and trying to share their experience about technology now that are implemented in their institutions. So it's very interesting, and we had many recommendations. And this event, we had almost 200 nurses and professionals coming from all over Lebanon to attend this event.
I think it's great that someone from nursing is interested in medical informatics because just what we were discussing before we started recording, the nurse's perspective always seems like an afterthought in a lot of decisions made in hospitals. So I'm really glad to hear that as a nurse, you're taking the lead and you're being proactive and you're organizing, as it seems, different stakeholders in terms of the digital transformation that's happening. So maybe before we talk more about the conference, you can tell us more about your journey and how you ended up interested in medical informatics, and you're pursuing a PhD in medical informatics. I think you're the only nurse in Lebanon with a PhD in medical informatics.
I don't have records about the others, but I think we are not, if I'm not the only one, we're not so many. So talking about my journey, in fact, I was interested in technology not since the beginning. So I was thinking that technology and care does not cross paths. So I was a nurse because I chose to be on the bedside, caring for patients, having this touch, this care. So when I started nurses 15 years ago, I chose this career because I was interested in this human touch and this interaction and saving people and being there for them, because nurses are there for patients 24/7. And I thought as a junior nurse that technology and informatics are not my role. And there are people dedicated to do this. So, and I chose nursing for other purposes. Then on my way, when I ended up managing nurses and 300 nurses and looking for tools to try to help them to do their job better, to try to avoid errors, to try to help out with the lack of nurses and the massive departure from the profession, and with all the crises, I need the technology to have a help. So I become passionate about having the technology helping nurses. So it was not a passion. My purpose was not a love for technology. It was having the technology like a colleague helping us and trying to give solution to my nurses and try to track their work. So I need tools to track the errors and their work, and I need a tool to help them do a better job. And I had Antoine, who is a colleague also, who is passionate about technology and who started his PhD, and we are working in the same team, and the hospital vision that was very supportive. So I become interested in technology from that point of view, helping nurses. And as you said, historically, the decision support and the technology started with physicians. So
With billing.
yeah, well, with billing first, and then when it comes to care, it comes along with the work of physicians. So the first decision support system in care was for physicians, and then the nurses were left aside or behind. So, and we are trying now to take the lead and to take the future of our profession in our hands. So we don't want vendors or other healthcare professionals to give us our tools the way they perceive that we must do the job. So we want to do the job as we know and as we want to plan it, as like our work flows. So this is why we are now trying to have more publication in nursing all over the world. We are having nursing informatics directors in hospitals all over the world. And I wanted to have my nurses and the Lebanese nurses on board in this. So this is why I want to use this technology to help nurses take the lead of the profession and take the profession of the future in their hands, not being like passive and having the others giving them their tools and guiding their work, because the future is here. So
Right, and I agree with you 100% because I see this in the US where like you implement some of the newer EMRs and then nurses have to document a lot in these EMRs like Epic or Cerner, and this is very time consuming. And I think if the nurses have a say in terms of how to document, what to document, and where to document it, then that would make their lives much easier. So just to go back a bit, as we Antoine wanted to say something.
Yeah, it's funny because in the beginning they were like putting budgets in order to digitalize the professional healthcare professionals' notes, and when they saw that EMRs in fact did not really lead to an improvement in the healthcare professionals' time with patients, but at the contrary, it led to an abuse of their time and even to make them feel less comfortable at work. Now, the next, budgeting in the US is for de-implementing, in fact, the EMR in the sense of how to re-engineer the EMR so it could take less time for nurses and physicians to put their documentation. So less documentation is now the objective.
Right,
This happens
exactly.
when we don't put clinician in the conception of the tools.
Right.
So when we don't have the people that will use the tool coming at the decision, at the conception, at the thinking, at the beginning of the idea, this will lead to users not using and not comfortable with the tool.
Right. And as we get there, I'm going to just go back a bit because I just want to tell people that when you became director of nursing, during that period of time, we don't want to talk about it a lot, but it was during the time when the August 4th explosion happened. And actually, Lebanese Hospital-Geitaoui was one of the most affected hospitals at the time. In fact, it was out of service and had to be rebuilt from scratch. And so can you tell us a bit about that period of time, the nursing exodus in Lebanon,
Yeah.
and the importance of having good nurses in the country?
Yeah. In fact, it's a very tragic topic to talk about, but I became director of nursing in the beginning of 2019. And since then, I am dealing with crisis. So first the revolution, the Thawra, and then the explosion, and then this non-ending tunnel of crisis and the financial crisis. And
Not mention COVID, يعني
Not
ما
yet.
يعني insignificant.
Not yet.
Throw in the pandemic, يعني.
Yeah, not yet. All this crisis thrown in a pandemic context. Yeah. And so I am a director of nursing in the middle of crisis management on every day. So the exodus of nursing and the workforce is very like the workforce is we have mass exodus and people leaving because they are very frustrated and they have a lot of burden and they are burnout. So, and the 4th of August was like the big problem in all of those crises. So we have lost more than 20 to 30% of the nurses in Lebanon, and we have lost our experts. So the people that have 5 and more years of experience, and we are left with young nurses, and those young nurses don't have the expertise that their colleagues that have left us has. So we have to do a training, more training to those nurses. We have to do more intensive companionship and mentorship and preceptorship to those nurses, and this is very heavy to manage. So in order not to have mistakes with patients or not to have very heavy workloads, we have to innovate and do a lot of solution. Not to mention that at a point of time, the salaries were like $50. So it was very heavy to ask a lot from a nurse with a $50 income. So it was a hard period, but we tried to stay and to do our best to serve the Lebanese population. And those who are still here are really doing their best to not to lose the level of nursing and the level of care and the quality of care we give. So we innovated really from low resources. We innovated solution, and we tried to find solutions and ways to do it in very low resources. And I think now we're better now. So the financial crisis is not over, and the political situation is not over. It's not solved, but we are better now because we have resistance and we believe in our mission.
I think nursing globally is facing a lot of challenges, and a lot of nurses in the hospital setting or in clinical setting are migrating to pursue other roles, and that's a global problem everywhere. So in Lebanon, you really can't blame the nurses.
Yeah. No, I respect nurses. I don't blame them, but it was hard to manage here.
Definitely, and all the respect to those who were able to survive and to persist and persevere through all those challenges. And I personally, I know more than 100 nurses from one hospital in Lebanon, who all of them moved to one hospital in the Gulf. So it's a lot of the junior nurses that you're talking about, as soon as they get those 2 years experience, 3 years experience, 5 years experience, they're getting great offers from overseas, and it's hard to say no. It's hard to say no. So all the respect for those who stay, and I really admire what you're doing in terms of using the technology to help you catch those errors. I know the last time we talked to Antoine, he talked about how he's using AI to even predict errors before they happen. So maybe now is a good time to segue back to the conference and talk about some of the major recommendations that you came up with.
Yeah, in fact, we recommend the conference has settled some recommendation that are to give our junior nurses and the undergrad at the undergrad level some courses about technology, because when they graduate, they will face technology in their everyday work, and it will be more more and more frequent in the coming years. So we recommended to give some courses about AI, about technology, about EMR in the junior, in the undergrad level, and at the graduate level, masters, etc. We also recommended to give continuous education to nurses and basic skills to those who graduated in other times, and they are now they didn't have the chance to have the computer literacy in their at their times. And we recommended also, I'm trying to remember,
The integration of the professionals
yes.
and
yes,
the choice of yes. So one of the major recommendations is the fact that the healthcare professional really should be involved in the choice and the evaluation of the tools they will be using, and take part in their own future and thought about tools and their impact on patients. So this is a major thing. All the people that were in the conference were really agreeing on.
Yes, we also added some recommendation about research in nursing, so that we do our own research, and because usually we are data collectors, nurses are more data collectors for others who want to test this or that. So we also recommended to be really taking the research, also the lead in the research, and testing our own tools, and doing our own research, our own usability, our own studies, our own publications also, and trying to encourage nurses to publish and trying to see the opportunities about research in our hospitals and institutions.
So basically, you'll have more of a consortium of nursing schools that will be publishing together, right? Or would it be like separate, each hospital separately that will be publishing?
No, we didn't do a consortium,
like a database, I guess.
No, we recommended to the institutions, so everyone will do it like they find it at the moment, they found it suitable, or the way they found it suitable for them. But we noticed that after the conference, many faculties contact us and try to think with us about the ways of integrating technology in their curriculum. So we noticed that after this conference, we really had some contacts with faculties, and we noticed that faculties are really interested in starting this. So and hospitals also, we had some colleagues talking together about this, and we definitely want to do a think tank with all the professionals, and maybe some meetings later on, and a society maybe in Lebanon for informatics, and maybe this conference and will be the stone that will build for society thinking about informatics in Lebanon.
There is a challenge in Lebanon. Maybe you're aware of it is that universities and institutions really do not collaborate with each other. Maybe it's because of the mostly dominant private entities, that competitiveness of these institutions, but it's really a shame that institutions in Lebanon really do not come together in research, in efforts to improve, and this is something that should be changed. So one of the objectives was also to bring this idea, and guys, let's bring together our efforts.
You notice that there are competitors, or they are not along in the same way of thinking in that conference. Something that is beautiful about this conference, that we had the biggest hospitals and the biggest faculties in Lebanon all together on the same table. So they are all together sharing their experience, and this was rich and very interesting. And now we want to collaborate together or think together about the future of nursing in Lebanon and technology that is now a fact in our profession. And I think that we can do a think tank or we can build something all together. And they were enthusiastic about it.
This is something we talked about with Antoine last time. We had this discussion about how the field of medical informatics is in Lebanon. It's young and it's budding and it's still not organized. We don't even have a society or like a formal umbrella group to have everyone in it. And to piggyback on what Christine was saying, I think a lot of people who work in medical informatics are comfortable with collaboration because by definition, to be in medical informatics, it's a multidisciplinary field. So it's great that we have nurses involved, we have engineers involved, we have people with PhDs, we have doctors. So I think there's a selection bias for people who go into medical informatics to have this multidisciplinary approach, like Christine was saying. Cynthia was saying, excuse me. But we need to have the different players from the beginning come together and talk about these problems. And it's great that a lot of institutions like in Geitaoui, you're building in-house this technology and you're not just paying hundreds of millions of dollars to import the software that was built overseas and that doesn't necessarily improve patient outcomes and that doesn't really work in the Lebanese context. Just to set the stage for people who are listening who are not practicing in Lebanon, outside of the big 5 medical centers in Beirut, most of the work in hospitals is done by pen and paper, and definitely in private clinics. I don't have any statistics. I don't know of any, but I would say more than 90% probably is done by pen and paper. We all know the famous or infamous روشتة الوصفة الموحدة. يعني everything is still done manually in Lebanon. So I think it's great that as we move into the digital era, that we're thinking of those problems early on in Lebanon and trying to come up with local solutions.
And as we said, maybe the last time, is as Lebanese professionals, I think we have potential. We have the potential to contribute to this future, to this technology, because of our experience, because of our education. So why not doing it? Why waiting for solutions that come from the outside?
Right. So I'm going to ask a question. So what, because I'm sure we're going to measure, right, success or milestones that will be occurring from this. And I mean, I'm thinking that maybe what's the perception of nurses right now, or do we have any statistics on how nurses are feeling right now at work, or something like that? And then how will technology help improve the day-to-day work of the nurses, the quality of life of the nurses? That's one, I guess, measurement. I don't know if we're going to measure that. And then how will technology help improve, I guess, research and medical errors and patient care?
Yes, indeed, we need to measure. So we have some research about perception before technology, stress, burnout, and the Lebanese nursing workforce. And now I think we, for those who have implemented the EMR and have used the EMR since some years now, few years now, we should do some more studies to measure the outcomes, some nursing, the impact, some nursing really focused indicators to see if we are better, and if not, why, and what can we do. So this is why, like Dr. Mohammed said, the solutions of coming from over the seas are not maybe impacting our healthcare systems or our daily work. Maybe we need to reshape or redo it. So we have to measure this, and I hope we will in the future.
Did you agree on a follow-up date, or will you be having a second meeting next year? Do you start having those talks yet, or it's too soon?
We have emailed all the main participants in the Congress, and they were so happy to do another meeting or to collaborate or to have the think tank all together. But we didn't have time to settle this meeting, but we will, and I hope we will tell you back what will happen in this project. We will do it.
And then what's going to be the role of, because we talked about technology, what will be the role of artificial intelligence, I guess, in this project? Like, where would it come? And I know we talked about, like, there was some talk about Chat GPT too, and
we start using ChatGPT in our daily work, not in clinical practice, but in finding some solutions or in our research project, in our management and the nursing administration. And we are now, I'm eager to start the AI standalone surveillance system that predicts deterioration. And we will be starting testing in the coming weeks. So I'm very happy to see how nurses will interact and how they will see the prediction of deterioration before the deterioration, and how they will interact with the system, and how it will impact, or if it will impact the patient outcomes, and some outcomes like stay transfer to ICU, or less RRT calls, rapid response team calls, etc. So I'm very happy, and Antoine maybe will also talk about
basically, yeah, AI has really the potential to impact care in many ways that were impossible in the past. As Cynthia said, for example, predictive analytics using AI can really help physicians and nurses predict the deterioration of patients before it occurs, so at an early stage. It will impact the way we monitor patients. It will impact the way we can detect adverse events in the hospitals. It will impact certain incidents that were really very hard to prevent, such as patient falls, such as pressure ulcers in patients. This technology, if it's used in a very synchronous way with wearables, it can really also change the game in the sense that it can predict some risks that are very individual to the patients, and help the nurses alleviate some work, and at the same time try to make the patient monitoring more efficient.
Not to talk about alerts and care plans and evidence-based nursing that will be more like available to nurses in their daily work.
Now, ChatGPT, for example, has a great potential. We're not here to talk about it, but I mean, you all know that it's a revolution in matter of knowledge management. But in the next years, when it will be really validated or more valid, it will really help professionals access to important and crucial information in a real time. And that can be really the difference between a good diagnostic or a management choice and a bad one.
Right. I think definitely right now we're going through this digital transformation, but it's good to also keep in mind that AI is a tool, and it's all about how you use it and how you integrate it. So it's good to be having those discussions early on to see how we incorporate those tools for our advantage. Otherwise, we'll end up with a big mess. The same way with EMR, it's just burdensome, it's just 1,000 clicks, and it doesn't necessarily improve patient outcome. So it's really important to keep that in mind, the patient outcome and the workflow of the different users.
And it can also harm sometimes, or it can harm patients, or made more mistakes, let the people make more mistakes. So it's important. This is why the conference said human touch care and human touch must stay, and the essence of nursing must stay, and nothing will replace a good communication with the patient and the touch and then eye-to-eye contact. So AI is here to help. We are not afraid of the future, because we now are thinking about the solution and how this technology will help us and how it works. But we are definitely, we know, and we are definitely we have attention not to use AI to replace or to harm or to be in the place where ethics will not go along with our ethics and our values.
I love that you bring up the human touch. I mean, this reminds me of the conversation we had last week with Tanya and Vlad, and how they also brought up the importance of the human touch and the importance of remaining true to ethics. Yeah. And we were having a completely different discussion about medical NGOs and humanitarian aid. So there seems to be a common theme emerging from our talk.
The essence of our work and the essence of the care, and the touch with the patient and
Right. For people who are scared of AI, it's going to be more of a tool to help hopefully improve patient care. And that's where your conference is important, because you want some data to show that AI is really improving patient outcomes, decreasing medical errors, decreasing hospital-acquired infections, improving workflow, improving staff satisfaction.
And predicting errors before they even happen. I think that's what Antoine was trying to say. It's
Right.
A lot of things that we don't even think are
Identifying
possible
patients,
right now.
identifying patients
Early
that
on.
are
At
early
risk.
at risk for errors,
Right.
or adverse events. In fact, practically, if you want to really combine today the point of view of nurses and physicians in this revolution, what we should do and what we're trying to do now at our hospital is to early on involve them in needs assessment of the technology, so that we incorporate all what they would like to have as features and what they identify as risks early on, so that we don't see that later at a later stage, and then try to involve them in the validation of the tool and the design stage and at the validation stage of the tool. And this will help the tool and the hospital reach the outcomes it really needs from this technology. So we're trying to do all this continuum of the process, so that we can reach and we can show at the end the real outcomes of AI.
And the important thing is, I think you're sharing in the decision making with everyone. It's not like coming top down where people are going to start complaining, because now people are making the decision with everyone in the administration as to what they want and the best way to implement it. So Cynthia, what's your PhD? What's your, I guess, PhD project right now at the Sorbonne? I know it's medical informatics, but
I'm trying to see how decision support systems can help nurses in the process of nursing, and the process is the basic of our daily work in hospitals. So when we have assessment, then diagnosis, problem and risk diagnosis, and then we build our care plan, and we say we have these problems, we will do this care to the patients, we have these risks, so we will give this intervention and that. So we might, if we are not, if we run out of time, or if we don't have the expertise, we can miss some problems, some interventions to do, some risks that must be tackled. So this clinical decision support system can help us when we assess the patient and we collect the data, to help us see what are the possible diagnosis and risks, and what are the possible interventions for these patients, so that nurses with best expertise can do the job like a 10 or a 15 years expert nurse. And so that when we are in a hurry and when we are not sufficient, we can do the job, because this assistance will help us in our care plans and will remind us of our intervention. So it's mainly this. And I'm trying to see in the literature what's done. And I will try to see in our context in Lebanon what nurses would want this tool, how will they want the tool to help them, and then try to like build a prototype, or try to if you want, suggest features for this tool.
So basically we're trying to use as we discussed before. I think we're trying to use AI to improve patient outcome. I think it's going to be important, especially with the efficiency of healthcare workers all over the world. This is an important topic, because you're going to lose a lot of the experienced people. So you want the younger people not to have as many errors up front, and have AI to assist them preventing errors or miscare.
Yeah.
Right.
And I think this is universal, like you were saying. It applies to the Lebanese context, but I think there's lessons to be applied elsewhere. I think the challenges in healthcare are more common than we think they are.
Yeah, globally, it's a crisis. Nurses are in crisis since many years, and it will stay in the future. But we Lebanese nurses are the top challenges. We have the top 5 challenges in the world, I guess.
So, any final words, Cynthia and Antoine?
I would like to thank you again for hosting us in this very interesting podcast. And I hope that we can prove to ourselves, to our colleagues, and to our fellow Lebanese that when we would like to do something serious in Lebanon, and when we would like to contribute to the future, we could do it if you are serious enough and if you have the chance. So again, I thank you again for this opportunity, and I hope that we can show you in the near future some fruits of this discussion.
Normally, when we went in our institutions, when we want things done, we give them to the nurse because they are here 24/7. They are coordinating care with all the team, with all the multidisciplinary team. So nurses are the biggest workforce in the hospitals. So they have a big role to do. So this is why I want to say to my fellows and colleagues that we nurses, we have to take our profession in our hands, and we can do the change we want to see, and we can be here in the conception and all the way in research, and we can help patients by trying to design our tools, by being proactive in AI and technology, and we can do it. And we're not afraid to let technology be used we're not afraid to be replaced, because no one will replace the human touch and the caring nurse. But we want this technology to help us in our daily work. And I hope all nurses will take the future of our profession in their hands and will go forward in this, and will have their tools, their new tools in the future, and new tools to work and to achieve goals and to impact patient lives.
There's one small quote, funny one, that we used in the event, which says that save one life, you're a hero. Save 100 lives, you're a nurse. And we added, save thousands of lives, and you're a nurse informatician.
I like
Yeah,
that.
that's a good one.
I have a lot of respect for what you both are doing in Lebanon, despite all the challenges and the pandemic and everything that's happening. And it's great to see that you're building something locally, and you're being at the forefront of this digital transformation that's happening in the medical field. And if we can support you in any way,
you're already doing it.
If anyone listening is interested in this new umbrella, or this new think tank, or this new society that's currently being grown in Lebanon in terms of medical informatics, we'll leave the information of both of you in the show notes so they can reach out to you. And hopefully next time we record, you'll have some sort of organization, if you can help in any way, to promote this. And maybe next time you have the conference, we'll be there. And
Oh, you're already invited.
We'll be the sponsors, the media sponsors.
Thank you for supporting our initiatives and for giving me this chance to share with you.
Yeah, thanks to all of you for being on the podcast. And I think hopefully this will shed light and improve nursing care and healthcare in Lebanon, but also I think it has the potential to improve healthcare in other areas of the world, because I can tell you, even in the US, there's a lot of problems. And even the hospital I work at, nurses were unionizing recently because of all the problems that were happening or what they're dealing with. Thank you very much.
Thank you.
Thank you.
Bye-bye.